Immunotherapy has become a standard treatment for mesothelioma, offering hope for significantly better outcomes. Like chemotherapy and radiation therapy, immunotherapy treatment is unfortunately accompanied by side effects, and some of these side effects can be serious if they're not recognized and treated promptly. Today, I want to explain what side effects to expect from mesothelioma immunotherapy, how they differ from chemotherapy side effects, what the warning signs of serious problems are, and how immune-related side effects are managed. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding immunotherapy side effects helps you recognize problems early when they're easier to treat. So let's start with how immunotherapy causes side effects. Immunotherapy drugs like nivolumab, ipilimumab, and pembrolizumab works by removing brakes on the immune system, allowing it to attack cancer more effectively. But when you remove these brakes, the immune system can also attack normal tissues. This is called an immune-related adverse event. These immune attacks can affect almost any organ, but certain organs are more commonly affected. The side effect pattern is completely different from chemotherapy. With chemotherapy, you expect nausea, hair loss, and low blood counts, while with immunotherapy, you might get inflammation in various organs. The most common immunotherapy side effects are mild, and they include fatigue that's similar to chemotherapy, but often less severe. You can also get skin rash or itching, diarrhea or changes in bowel habits, decreased appetite. These affect 20 to 40% of patients and are usually manageable. More serious immune-related side effects that require immediate attention include colitis, which is inflammation of the colon that causes severe diarrhea, abdominal pain, and sometimes blood in the stool. This affects about 5 to 10% of patients on dual immunotherapy. Hepatitis, which is liver inflammation, causes elevated liver enzymes, dark urine, and abdominal pain, and it's usually detected on blood tests before symptoms even appear. Pneumonitis is lung inflammation. It causes cough, shortness of breath, or chest discomfort and affects 3 to 5% of patients, while endocrine problems like thyroid dysfunction, adrenal insufficiency, or pituitary inflammation can cause fatigue, weight changes, or hormonal imbalances. Now, before I go on, I want to ask you to do me a favor. If you're finding these videos helpful, please hit the like and subscribe buttons below. It makes it a lot easier for other people to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, getting back to the side effects, skin reactions beyond mild rashes can occur. These can include blistering or peeling that might indicate serious conditions. Kidney inflammation or nephritis can lead to changes in urine output or elevated creatinine on blood tests. Neurological effects like numbness, weakness, vision changes, or severe headaches, they're rare, but they're serious. And the dual immunotherapy combination of nivolumab and ipilimumab causes more and more severe side effects than single-agent immunotherapy. About 50 to 60% of the patients on dual therapy experience some immune-related side effects, with about 20 to 30% experiencing serious ones requiring treatment. Single-agent pembrolizumab or nivolumab alone causes fewer side effects. Only about 10 to 20% of patients experience serious immune-related events from that treatment. When do immunotherapy side effects appear? This varies. Some side effects appear early, within the first few weeks of treatment. Skin rash and diarrhea often appear early, and other side effects can appear later, like months into treatment or even after treatment has ended. Thyroid problems often appear several months into treatment, and pneumonitis can appear at any time. Rarely, immune-related side effects appear weeks or months after stopping immunotherapy. And this delayed onset makes it a lot more challenging to recognize that the symptoms you're seeing are treatment-related. How are immune-related side effects managed? For mild side effects like rash or diarrhea, symptomatic treatment with anti-itch creams, anti-diarrheal medications, or dietary changes may be sufficient, and immunotherapy can continue. For moderate side effects, immunotherapy is temporarily held up while the problem is addressed. For example, if you develop moderate colitis, immunotherapy would stop so you can receive anti-inflammatory medications or low-dose steroids. Once the colitis resolves, immunotherapy can resume. But when severe side effects occur, immunotherapy is usually permanently discontinued, and high-dose corticosteroids are started immediately to suppress the immune attack on the body. For example, severe pneumonitis requires stopping immunotherapy permanently and starting high-dose prednisone or methylprednisolone. As the inflammation resolves, the steroids are gradually tapered off over a period of weeks or even months. Some severe immune-related side effects require additional immunosuppressive medications beyond steroids if the steroids alone don't control the inflammation. Now, why is early recognition so important? Because immune-related side effects are much easier to treat when they're caught early. Mild colitis can be managed with brief steroids and immunotherapy might be able to resume, while severe colitis that's been ongoing for weeks, that might require permanent discontinuation of immunotherapy and prolonged immunosuppression drugs. Similarly, mild pneumonitis caught early responds well to steroids, while severe pneumonitis can be life-threatening and can cause permanent lung damage. So what symptoms require immediate medical attention? Severe or bloody diarrhea, more than 4 to 6 watery stools per day, or any blood in the stool. Severe abdominal pain, new or worsening shortness of breath or cough. Chest pain, severe rash, blistering or peeling skin, yellowing of skin or eyes. Severe fatigue, dizziness, or fainting that could be an indication of an adrenal crisis. Vision changes or severe headaches, numbness, weakness, or difficulty moving parts of your body. Don't wait to see if these symptoms improve on their own. Contact your oncology team immediately or go to the emergency room. Your oncology team will give you specific instructions about what symptoms require emergency attention versus calling the office versus waiting until your next appointment. Monitoring during immunotherapy includes blood tests before each infusion, checking liver function, kidney function, thyroid function, and sometimes other hormones. You'll be asked about symptoms with each visit. You might need periodic chest x-rays or other imaging to monitor for pneumonitis. This monitoring helps catch problems before they become severe. Can immune-related side effects be prevented? Somewhat. You'll be screened before starting immunotherapy to make sure that you don't have underlying autoimmune diseases or chronic infections that might be made worse by immune activation. You'll be educated about what symptoms to watch for. Beyond that, there is no way to prevent immune-related side effects while still getting the cancer-fighting benefit of immunotherapy. The immune activation that attacks cancer can also attack normal tissue. That's the fundamental trade-off. So, do immune-related side effects mean the immunotherapy is working against your cancer? This is a common question. Some studies suggest that patients who develop mild immune-related side effects might actually have better cancer responses. But this isn't consistent across all studies, and it does not apply to severe side effects. Developing side effects doesn't guarantee a benefit, and not developing side effects doesn't mean the treatment isn't working. Response to treatment, it's determined by tumor measurements on scans, not by side effects. Now, what about long-term effects? Some immune-related side effects resolve completely once the treatment is over. Others, they can become chronic conditions requiring ongoing management. Thyroid dysfunction often becomes permanent, requiring lifelong thyroid hormone replacement. And type 1 diabetes from pancreatic damage is permanent, requiring insulin. Most other immune-related side effects either resolve or improve significantly with treatment, though this can take months. To review, mesothelioma immunotherapy causes different side effects from chemotherapy, not nausea or hair loss, but potential immune attacks on normal organs. Common mild effects include fatigue, rash, and diarrhea. Serious immune-related effects include colitis, hepatitis, pneumonitis, and endocrine problems affecting 10 to 30% of patients, depending on what regimen they're receiving. Early recognition and treatment with steroids and holding off on immunotherapy is critical. Report severe diarrhea, shortness of breath, severe rash, jaundice, or other serious symptoms immediately. Visit mesothelioma.net for more information about immunotherapy and managing its side effects. Or you can call 1-800-692-8608 or use the live chat feature on the website to speak directly to one of our helpful patient advocates about where to find more resources. As for me, remember to post your questions below, and I'll see you next time.